My name is Randy Gearhart, and I am the director of the spiritual care department at Genesis. Well, my journey to become a chaplain was a kind of an interesting one. My original career goals were that I was going to join the Oregon State Police Department and become a state patrolman. And partway through that process, my goals changed a little bit, and I ended up feeling called into the ministry. So I actually went back to school, got my MDiv degree in theology, and I actually pastored for about 13 years before going into chaplaincy. And I think the thing that led me into the direction of chaplaincy was that I always enjoyed my time in the hospital, visiting patients and visiting parishioners in the hospital. And over the years, I'd had people tell me, you ought to become a chaplain. And so that was kind of always in the back of my mind. And after a number of years in church ministry, I ended up going back and taking all of my chaplain's training and went into chaplaincy. And that's been almost 30 years ago now. The question of what is spiritual care is actually a question that chaplains get asked quite often. I think probably the easiest way to explain it is that, as human beings, we are holistic beings. We have our body, our mind, and our spirit. And spiritual care is basically just caring for that emotional and spiritual part of who we are as a person. When you're walking side by side with people in the hospital through some of the most intimate and painful experiences of their lives, which of course happens daily in an acute care hospital setting, that's not easy. And if you truly are investing yourself emotionally in that experience and truly walking side by side with that individual and with that family, it's not easy. And of course, all hospital staff experience that. I mean, it's not just the chaplains. Obviously, the chaplains were there to provide that emotional and spiritual support, but it's very difficult for the clinical staff too, because they're focused on the physical needs of the patient, and yet at the same time, they cannot help but be impacted emotionally by those devastating experiences that our patients and family members are going through. And so when I hear healthcare workers described as heroes, and I really believe that that's true, because when you especially as a chaplain, when you see the experiences that they daily go through and that they deal with on an emotional and personal basis, it can be very, very hard to walk out the door of the hospital in the evenings and leave all of that behind and focus on your own family and your own children and yourself. And so self-care becomes very, very important. Well, people in the community might be surprised to learn that the chaplains that make up the spiritual care department are very ecumenical. Sometimes folks might think that, well, because Genesis is connected with Catholic healthcare, that the chaplains all there are Catholic. And that's not the case. We actually have 5 chaplains, myself included, and we are all from different faith traditions, different backgrounds. And so the spiritual care department is very ecumenical in its makeup. And as chaplains, we're there to provide emotional and spiritual support to our patients and their families in ways that are meaningful to them, regardless of what their faith tradition might be, or even if they have no faith connection whatsoever. But we are there to provide that support to them.